A report by the Daily Maverick has revealed that the fire that destroyed part of Charlotte Maxeke Hospital was an act of arson. This follows an SAPS forensic analysis indicating that last year's fire was a deliberate criminal act. We're joined by Dr. Angelique, Coetzee, advisory board members for Solidarity Doctors Network. Thank you very much for availing yourself this afternoon. So the Department of Health says it has not received this report. Is this something you are privy to at least?
Good afternoon, and good afternoon to all your listeners and viewers out there. Yeah, you see, officially we don't know anything because no report has been coming forth from the police. National Department of Health apparently is not really wondering why after 18 months there is no report released as yet. We know that Mr. Jack Bloom, the DA, last month already asked in Parliament why is the report leaked and why is there nothing officially coming out. And this is a huge concern to us because it looks as if it is inefficiency at its best and corruption at its worst, because no one is really interested, and the public has got a right to know. Got a right to know what is standing in that report, why is it not made public, and when is it going to make public, and why is it not really seem to be a concern for the Provincial Department of Health to get that report. It's unacceptable.
The report itself that the Daily Maverick has made public, it notes that an initial request for a forensic fire investigation was made by the investigating officer from Hillbrow SAPS, and Ramsanda reports that he attended the crime scene on the 28th of April, 12 days after the fire.
Well, in any country, if there's a fire of a hospital, there should be immediate action taken, especially in a hospital like Charlotte Maxeke Hospital. You know, it's a huge hospital. It's a big hospital. So, but in South Africa, you take 6 months later before you interview the hospital staff. 6 months. Is that how the police works? To take 14 days or so after a fire for a senior person to go and really start to investigate. And yes, according to the leaked report, there was an investigation was fought. And again, we don't know anything about it. So when are we going to change this type of behavior in our country? This is not acceptable. Again, I'm going to say it's inefficiency at its worst. It's corruption at its best, or the other way around. It doesn't matter how you look at it. It is wrong that is happening. It places a big question mark around the police commissioner, minister of police, about the premier of Gauteng, the provincial department of health of Gauteng, the Charlotte Maxeke Hospital, because accordingly to the report during that time when the fire broke out, there was an audit going on. We know there was around about 40 million of goods in that storeroom that's been demolished. And so, what is the true story here? Is it a cover-up or isn't it a cover-up? Why don't we have in our country accountability from leadership and people that the average person out there in the public needs to trust? They need to trust the police, they need to trust the hospitals. Why don't we see that?
Dr. Coetzee, the notion that this may be corruption at its worst, is that based on this, did you say 140 million worth of, or 400 million worth of stock that was in the hospital?
40 million. There was 40 million according to some reports. 40 million rands of stock in that storeroom that was destroyed. So what type of stock was that? Why was it destroyed? You know, to just start a fire in a hospital, incidentally, is not easy. Hospitals should have fire detectors there. There's personnel, there's staff out there, there's guards out there. So how do you get a fire that nearly destroyed a whole hospital by someone just making a fire. And that it's another thing if it's in Cape Town and it's a Tableback Mountain, that's something else. But here we're talking about a fire that nearly destroyed the hospital. How? How on earth did that happen? Why, 18 months later, we still don't know the truth. We've got a leaked report. If that was not for that report to be leaked, we would have been none the better off at this stage.
Dr. Coetzee, thank you very much for availing yourself this afternoon. Dr. Angelique Coetzee is Advisory Board member. Thank you very much for your time.